You're listening to Healthcare Now Radio. Stand by for This Just In, the latest in healthcare innovation and technology trends with your HIT advisor, Justin Barnes.
Thank you for tuning in and welcome to This Just In. I'm your host, Justin Barnes. In these half-hour segments, I'll bring you the latest advancements in healthcare, strategy, innovation, and public policy. As always, we're broadcasting from the This Just In studios on the Business Radio X network as well as the Healthcare Now radio network. And before we dive into my special guest today, I want to take a moment to let everyone know that we'll be broadcasting the This Just In radio show again live from the HIMSS annual conference next March in Las Vegas. Many more details to come, but I hope everyone is planning on attending. Hotels are getting busy, flights are getting booked. So please, if you attend HIMSS, the annual conference, take time to book your travel. And we'll have another great slate of CEO, CIO, leading care providers, industry thought leaders, and certainly policymakers joining the show. But for this episode, my 109th episode, we have a special guest and good friend, Dr. Sylvan Waller. Welcome back to the show, my friend.
Thank you very much, Justin. I appreciate the opportunity to be here today.
Yeah, you were one of my guests back in 2015. Actually, I thought it was 2014 when we first launched the show, but it was September 15, and obviously a great guest, a lot of insight around telehealth at the time and the evolutions of where virtual care was going, and you had a very cool company, Elite Healthcare. So I look forward to, even having a deeper conversation now, but also, you and I have certainly stayed in touch and are collaborating on a couple of projects and just, the last couple of days said, you know what, let's do a radio show again to talk about all that we're touching in the industry. And we'll dive into that in a moment. But thank you very much, my friend. So
not a problem. And I appreciate it.
So where were you, for my audience, where were you born, raised, college, all that good stuff? So you can take a little bit of a step back just to bring everybody up to speed.
Absolutely. I grew up in Hawaii. I was born in Seattle, Washington, but spent most of my childhood in Hawaii, and then left for college when I was 18. I always tell the story that Hawaii was a great place to raise kids. Very isolated from the rest of the U.S. And so my family was originally from the East Coast, so I had an opportunity to go back to college in the Northeast, went to Brown for undergrad. And as you can imagine, that was quite a culture shock coming from, shorts and T-shirts in Hawaii to Ivy League and the cold of the Northeast. But loved the area, loved the experience that I had there. And really, as I went through my college career, started thinking about professional options and had always really been interested in science and biology. Wanted to be a marine biologist when I was younger. And as I got up to college, started to think a little more practically about how that translated. And so really spent, my 4 years focused on the sciences, biology, chemistry, physics in particular.
Yeah, I didn't realize marine biology. The irony here is my sister graduated at Brown and is a marine biologist in DC.
And they have a great program, and that was definitely one of the things that helped attract me to Brown was their focus on marine biology. So loved it while I was there, but what I found was when I started thinking about doing that as a career, I didn't just want to do research. I wanted to do something that was more applied, more practical, and really it was my mentors in college who started to steer me towards medicine. And no doctors in our family. But I really looked at, how do I take the basic science and what I've learned in biology and apply that to be able to, make a difference in people's lives. And that's really got me interested and excited about medicine. When I graduated from college, I wanted to test out and learn more about healthcare. And so I joined Accenture on the West Coast, focusing on their healthcare and financial services practice. And then at the same time, I volunteered in the ER at San Francisco General Hospital and was part of the trauma team doing CPR on patients that came in. So it was definitely a formative part of my life, incredibly exciting. And professionally, really got to see the inside of healthcare from both a payer perspective, the provider perspective, and then obviously, working with physicians and residents, in the hospital environment as well.
Yeah, and we've had several touch points just because we live in the same community in Atlanta, but then also you recruited me into the ATDC as an entrepreneur in residence after I'd sold Greenway, and then it was a great opportunity to become an EIR there at Georgia Tech at their ATDC incubator, and I was filling your very big shoes. So thank you for that opportunity, because that was a great year down there. And then a couple of us had started this health innovation think tank in partnership with HIMSS and Lenovo and Inventive and UPMC and others. And very quickly, one of the first names that came up to be a catalyst. We really didn't have speakers. We have about 50 people. You know the setup, but just for my audience, we have these health innovation think tanks, and we basically pull 50 global thought leaders together, really every 3 to 4 months. And the very first person identified, even by Lenovo, was you. I think you were just rolling off Chief Medical Officer for MD Live, was it?
Yep, that's correct.
Yeah, and you were just rolling from there. Yeah.
No, I appreciated the invitation to join the think tank, and I think it's been a great experience. My career has really spanned sort of the clinical side of medicine as a practicing emergency medicine physician, but then really focusing on innovation and digital health as well. And my career really focused on scaling, physician practices, creating these large national physician practices, and then really understanding, how does innovation impact them? How does digital health have an opportunity to reshape those practices, reshape the physician environment, reshape, most importantly, how patients get care. And so that really has been, a big part of my focus professionally. And having done that for a number of years, and then having the opportunity at the, Advanced Technology Development Center to, be an entrepreneur in residence there and a mentor, great experience. Certainly, appreciated the opportunity to meet you in that environment, and as I was rolling off, invite you into that community as well. And then you're absolutely right. I had the opportunity to found and run a telehealth company. Ultimately did that for a number of years, and then worked with MD Live, which is one of the oldest and largest telehealth and virtual care companies in the U.S. And did that for a while, and then have been consulting now with a number of the fastest growing, most innovative, virtual care companies in the U.S. And so the experience has been tremendous. I think we had an opportunity to really talk about some of those, lessons learned and where virtual care is going at the think tank recently. And we thought this would be a great experience to be able to share that with your listeners today.
Yeah, and that's exactly it. I think this is one of the most exciting aspects to where healthcare is evolving, not just here in America, but certainly globally. And I think, when you and I, we have a lot of projects kind of in play. I do panels together and think tanks together and a lot of different things, just collaboration points. But I think over the last couple of days, when you and I were sitting there over a dinner and just said, you know what? We should really bring this. There is this think tank. We are coming up with so many great best practices, so many great strategies, what's working, what's not working. And with your breadth and depth of knowledge and expertise, I'm like, you know what? We pulled the show together, I think, in less than 36 hours. So for that, I also thank you. People usually prep and we plan these out a couple of weeks or more, but this was just so important, so much great key content. So, but let's dive into some of it, because it's very exciting. It's on the tip of where healthcare is evolving, and where so much opportunity is. So let's, just starting off, how did you get your start in digital health? I mean, obviously your passion came up through you being a doctor, seeing how healthcare is evolving, Ali'i, MD Live, but what really drove you into digital health initially?
Yeah. So, I always tell the story. I started with Accenture, which was a strategy and technology consulting firm. After I was in management consulting for about 5 years, I went back to medical school. And so really having that combination of the business background as well as being a clinician meant that, at the companies that I worked for, primarily physician-led, when we were really looking at how technology was going to impact us, I was the guy who had, a little bit more technology experience than anyone else, and most importantly, an interest in it. And so it really, developed out of my my work with physician practices to try and integrate new technologies, to see the challenges that we had in implementing, new electronic health records, and trying to understand, what to do with our data. But it was really, the background that I had in healthcare technology consulting that led to my continued interest, and then really spearheading a lot of the programs and initiatives we were doing in these large physician practices.
That works perfectly. So what's created this focus on virtual care? I mean, why in healthcare? Again, it's as we mentioned, it's outside just our borders, but why this focus on virtual care today?
Yeah, good question. I mean, I think, as I've said before, virtual care will sort of be the 30-year, quote unquote, overnight success story.
Yeah, exactly.
People have been working on it for a long time, but the macro trends are now at a tipping point where we are seeing much more adoption and utilization. And those macro trends really come from, increasing demands on our healthcare system. We've got an aging population, more and more chronic disease burden. We have a increasing physician shortage. So by 2025, the projected shortage is now up to 125,000 physicians.
Wow.
We have the democratization of technology. So, according to Pew Research, 80% of consumers now have a smartphone that allows them to access an app or go to a website or do not only phone, but video conferencing as well. And so, as our services have become more and more mobile, right? We bank on our mobile device. We book, travel on our mobile device, dinner reservations on a mobile device. Certainly people are dating, based on their mobile devices. All of these things have created that consumer demand and that democratization of technology where people are looking for these same services and the same way to access healthcare. And so that's been a big focus of, the digital health and innovation spaces is how do they capitalize on those trends, provide patients and consumers, people who need these services at the end of the day, with an experience that is, matching their expectations. And as healthcare has always been, challenged in terms of really being consumer focused. And so when the average wait, according to Merritt Hawkins these days, is 29 days to see a family practitioner in the U.S., people are looking for alternative access points. They're looking for, better ways to be able to tap into their healthcare experience overall.
Yeah, no, I agree, and that's spot on. I mean, even the health plan that I just recently, purchased, offers free telehealth and just free visits, unlimited. And it's made a big difference just in accessing information, getting expertise, prescription refills, and so forth. So, yeah, I mean, I've seen it just on a simple scale like that, but and I look forward to using it a lot more moving forward. So tell me about the evolutions, because obviously I think we're still in like 1.0, but I think we're probably moving into maybe 2.0 in how virtual care is evolving, certainly here in America. So what are your thoughts there?
Yeah. I think part of what we discussed at the think tank recently was, that virtual care is really a solution. It's not just the technology platform. Mm-hmm. Yeah. And if you think about sort of virtual care 1.0, companies were mostly focused on creating a technology platform. Many of these companies were built by, incredibly smart and capable and accomplished technologists who didn't necessarily have healthcare experience. And so they looked at it and said, we've got a tremendous problem around access. We know how to solve that problem through technology. We can give people, effectively a website, an app on their phone, and then we can connect them with a doctor network on the back end. But really the 1.0 version of virtual care found that didn't drive adoption. Mm-hmm. They couldn't just put it in the marketplace. And I've had these discussions with some of the, thought leaders at Google as well. They wanted to create a healthcare technology, put it out into the marketplace, and then have rapid consumer adoption. And healthcare just doesn't work that way. It requires education. People are dealing with life or death decisions. And so creating, a technology platform on its own doesn't really solve the problem, doesn't drive adoption, doesn't, create that value proposition that all of us are looking for. And that's really led to, sort of the next version, the next evolution of a lot of these, virtual care companies that understand it really has to be a solution. It has to encompass not only great technology, but it has to have the workflow to be able to go with it. It has to be able to, create real value for patients, real value for the physicians and the care providers who are in the network, and then real value for, the enterprises that are involved, either in the delivery or purchasing these services.
Yeah, I think that's one of the pieces that we saw very quickly, at least part of our second think tank, is it's got to be integrated into the care model, and it's the overall care model that matters. And I know we'll get to some of those takeaways here in a little bit, but I couldn't agree more. And for my guests, for my listeners who just joined us a little late, my guest today is Dr. Sylvan Waller. And we're talking virtual care and virtual care strategy. So what are some of the barriers to adoption? Because obviously they're still great, and it hasn't taken off, and we've covered a little bit so far, but what are your thoughts there?
So one of the biggest barriers, as we touched on just a moment ago, is really, these technology platforms were put in the market without sort of a comprehensive solution. And you really have to understand, what's the problem you're trying to solve. So if you are a physician practice and you are trying to, create additional access in your practice, improve the level of service, you want a virtual care solution that's integrated into what you're doing. And you're absolutely right. The 1.0 version, was really a standalone model that wasn't integrated into the overall fabric of healthcare. And the 2.0 version is trying to be much more integrated into that fabric of healthcare. So as we talk about, the dreaded interoperability word, as we talk about, making sure that your primary care physician knows when you've been seen in a virtual environment and has access to that information. And as importantly, the virtual care providers who are seeing you, the physicians there, can actually, access your prior medical record. But all of that's really been a barrier in that, telehealth has been sort of a point solution and hasn't been integrated. And now we're seeing much more integration, and that comes with greater trust and greater credibility. And I think, one of the companies that I work with, Epic MD, their solution is really to partner with individual physician practices to be able to offer, a better solution that's supported by the physician, that's integrated into your practice already. And so it's not losing a patient to a different service. It's really being able to, integrate virtual care into an existing practice and offer, the ease of access to these patients. And they've seen, tremendous patient adoption in this new modality of care.
Yeah, I agree. The other side is obviously we do have some regulatory hurdles. We discussed that a lot during the think tank. You specifically brought up, what states are doing and how that's getting better, and some state and some state packs and so forth. And obviously, and then that usually precedes reimbursement, because we still have very limited reimbursement for virtual care visits. But what are some of your quick thoughts there?
Yeah, so you're absolutely right. Both the regulatory and reimbursement side still remain significant barriers to adoption. Reimbursement, CMS is looking at this, more and more closely every day. We're seeing that they're slowly inching forward. I tell the story that sort of 5 years ago, I thought that CMS would reimburse for general, acute care telehealth within the next year or two. Well, we're 5 years later. I still think we're a year or two away. But it's anybody's guess at this point, sort of when that wholesale change will happen. And so now companies have really looked at how do they create, more targeted niches? What are the alternative business models? How do they get paid for their services? And we see a whole host of services there, from patient pays to, employer pays to, the health system is actually trying to offer this to their patients, and they bear the cost of this. So it really goes back to sort of the problem that you're trying to solve.
Yeah.
And then you're absolutely right.
No, go ahead.
On the regulatory side, the individual state mandates around medical licensure, around the ability to provide virtual care, still provide a lot of fragmentation in our health system and a lot of barriers. And we're seeing that slowly broken down with the interstate compact that's coming or has recently been expanded. We're also seeing that, obviously with the lawsuits against the Texas State Medical Board around, telehealth and virtual care, siding with consumers at the end of the day so that they can access the care without being, subject to a lot of, monopolistic practices.
Yep. So Yeah, and I completely agree. The other side of this, and I think the reason why it is very important, obviously, to have reimbursement structure around this. But the other side is if we adopt more value-based care models, then you may not need to be specifically reimbursed for a visit because you can see the actual cost savings and readmission preventions and all those kind of components. I mean, there's so many attributes to a virtual care and a telehealth strategy to keep a healthier, keep the patients healthier, give them the care they need when they need it. Don't let illnesses and chronic conditions drag on without treatments. Just regular check-ins. All those may not be reimbursed per se through a traditional reimbursement fee schedule. However, if you're actually in a value-based care model and you're paid for based on the outcome, it could very well be worth it, and there's intrinsic value. What would you say to that?
Absolutely. And that's where we're seeing more and more traction. And again, one of the clients that I work with, Call 9, which provides, acute care services within a skilled nursing facility, their model is really built around value-based care. So they like every other healthcare provider today, have one foot in the fee-for-service world and one foot in value-based care because they have to. But the true value of a service like that, to be able to provide care, at the patient's bedside almost immediately and a higher level of care to an underserved community, really is around value-based care. They help, prevent those patients from having to unnecessarily go to the hospital, and where they can treat them for, a number of different clinical conditions in place. And the value of those types of services is tremendous. And we're seeing, as I talk about sort of the 3.0 version of virtual care and telehealth, we're really seeing those models emerge as being, the successful models that understand the challenges around the regulatory and reimbursement model, but are really forward thinking and are focused on value-based care, understanding, the overall cost savings, improvement in quality and access that they provide. And I think those companies that really focus on that are going to be the winners as we go forward.
Yep, I agree completely. So in our closing few minutes, I do want to cover some of the great takeaways that we had, and we haven't published all of this publicly, but I'm going to break some of our rules in the think tank and I'll let some of these out because we will certainly over the next couple of weeks. But and we've covered some of this, so I want to go through this and I'll get some of your reactions. And again, we've already covered some of this. So ask what you want out of your care model in your virtual care model. So specifically, do you want to attract customers, expand your reach, reduce your cost, enhance access? And you said this at the top of the show. What do you want out of it? What's your strategy? So I think that one's pretty much spot on. The second one here is it's the care model that matters. And again, we've touched on that one already. Virtual care will suffuse every element of care. And I completely agree with that. And I think that was even one of the points that you had brought up is, this is going to affect every component of your care model, whether your care delivery model, whether you realize it or not today. You've got to make sure, that you're planning for it, into your care design, proper change management. So what are some of your thoughts there?
Yeah, I mean, you're absolutely right. People, will start and have started even changing the language that they use around this. So, instead of referring to virtual care as just a standalone service, we don't refer to, the medicine that you get in the ER versus, your primary care doctor's office versus the specialist office or, in an inpatient environment. The medical care is the medical care, right? We don't say that this is, medical care that's only provided in the ED or only provided, on an inpatient basis. And I think virtual care will follow those same trends. We don't distinguish now, if we have pneumonia, we don't talk about whether it was diagnosed in an urgent care or the ER or my primary care doctor's office. It's pneumonia. And I think virtual care will lend itself to those same things. We'll be able to do a lot of diagnostics, home health monitoring, management of chronic disease, and it'll just be part of the overall continuum that is healthcare. And I think it will help with cost, quality, and access. But at the end of the day, you get to pick one or two of those at best, and you have to understand that, for your strategy to work, you've got to be laser focused on, what's the most important thing to you, what's the biggest problem you're trying to solve.
Yeah, no, I couldn't agree more. And you brought it up here a little bit, but and just in closing here, we have about a minute left. But the virtual patient advocates, I think we've seen that, or even patient assistants, and then the use of voice, where Alexa, Siri, The leaders today are Amazon, Google, and Apple. Voice first, not voice only. I think that was a good best practice that came out.
Yep.
But there's lots of opportunity there. Voice can lower the friction in the care process for everybody, not just the patient, but for everybody. Virtual therapy assistants, and then there's even Alexa can be HIPAA compliant. One of the partners there and one of the people inside the think tank had a HIPAA compliant Alexa set up because they can de-identify the user. So that's very, very cool to use voice as part of virtual care strategy.
And I totally agree. Reducing that friction is key to what we're trying to do and will drive even more virtual care adoption.
Yep. No, thank you. And real quickly, in 10 seconds or less, I always ask this question of my guests. What is your favorite place to get or be inspired, Sylvan?
Good question. Well, I grew up in Hawaii, so I always go back to the ocean. And any chance I get, I love going to the ocean. I love being able to look out at the water. It helps me sort of reset, get inspired for the next project that I'm working on. And I will always go back to my childhood in the ocean.
Awesome. I didn't grow up on the ocean, not too far from it, and the ocean is where I get most inspired as well. So thank you very much, Dr. Waller. I truly appreciate you joining the show today and taking the busy schedule to be with us. And thank you to everyone for listening and joining us today. Please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag #ThisJustIn so we can respond to your comments from the show. In addition, all my content will be posted at justinbarnes.com. Thanks, everyone. Have a terrific week.